Hi there, welcome back to my channel. My name is Sheila and I am a travel occupational therapist and certified hand therapist. And in this video, I'm going to be sharing with you how to transition into hand therapy if you're a new grad that's looking to break into hand therapy, or if you've been a practicing occupational therapist or physical therapist and you want to make the transition into hand therapy. So if you are new here, I am a travel occupational therapist. I've been traveling for about a year now, and I've been a certified hand therapist since 2019. I have been practicing as an occupational therapist for quite some time now, and I figured that I'd share some information because I've gotten more questions recently about how to make the transition into hand therapy. So hopefully this video is helpful for you if this is something that you're interested in. So I've been practicing as an occupational therapist for several years now, and I've been traveling for coming up on 1 year now. So just some background, I have experience primarily in the outpatient setting, but I've worked in the acute care settings, but my bread and butter is treating orthopedic hand, wrist, elbow, and some shoulder diagnoses. So what is hand therapy? So hand therapists are physical and occupational therapists that are specializing in the treatment of upper extremity diagnoses of the hand all the way up to the shoulder. Hand therapists' work can be outpatient clinics, hospital settings, and freestanding clinic. If you're an occupational therapist or physical therapist that's looking to transition into becoming a certified hand therapist, it is a very rigorous exam, and you have to practice for at least 3 years and have a documented history of working with diagnoses of the upper extremity. And I believe it's 3,000 hours that you need to have under your belt with treating these particular diagnoses. Some common diagnoses that hand therapists treat range from anything from fractures, dislocations, and even post-operative care of extensor tendon repairs and an entire gamut of various diagnoses. Other common diagnoses that we treat are repetitive strain injuries, so that can look like carpal tunnel, Decker veins, trigger finger, and other diagnoses that we commonly treat. And depending on the clinic, there will be a lot of splinting as well. And in addition to splinting, there's also a lot of manual therapy, therapeutic activities, and therapeutic exercises. So first up, can you transition into hand therapy as a new grad? The answer is yes. However, it does come with some challenges. Hand therapy is considered an advanced practice setting. So the expectation is that if you have a field work in hand therapy, you should be able to have a strong base and foundation in anatomy and biomechanics. And it is difficult to get into hand therapy as a new grad, but it's not at all impossible. I know for myself, speaking from experience, I was able to transition into an outpatient setting as my first job straight out of school. But what really worked to my advantage was that I did one of my clinical field works in hand therapy. So I had a firm grasp on treating some of the more commonly seen diagnoses in hand therapy. And I would say that if you are in school and you're thinking of sitting for your CHT eventually, absolutely, it will be to your best benefit to see if you can get a clinical field work within hand therapy. That way, when you're applying to jobs, you can speak to your experience during your time in field work, and that will make it so that you are communicating to employers and mentors that you're serious. And even though you will need some degree of mentorship, it is a huge benefit to have that strong base of knowledge in hand therapy. But the main issue is getting experience. So how do you gain experience as a new grad? First, it is very helpful to have clinical field works in hand therapy. If you are required to have volunteer hours, and even if you're not required, I would highly recommend finding area hand therapists that are able to mentor you or allow you to come into the clinic and just observe. That way you're able to see some diagnoses. And what becomes very important with transitioning into hand therapy is showing how you're willing to really learn about treating these injuries. I have been on the side of the hiring process where we probably had some therapists that were transitioning from other settings outside of hands. And what we wanted to see if they didn't have a clinical field work is that they took some time to seek out opportunities to shadow or opportunities to work closely with a CHT or hand therapist. Because this is such a specialized area of practice, we definitely considered individuals that took the time to study outside of work, to seek out those educational opportunities. That's who we were most impressed with, and that would give you a leg up as you're trying to transition into hand therapy. There are so many different conferences that go on year after year. If you can take some time to seek out these opportunities or attend these conferences, that gives the hiring managers some interest that you have. So with gaining experience, what's going to be very helpful and work in your advantage is if you have any clinical field works in hand therapy, if you have sat and shadowed some occupational or physical therapists that happen to practice in hand therapy, those are going to be huge in helping to give you a leg up. And also mentorship opportunities are going to be helpful, not only to expose yourself to treating these injuries and diagnoses, but it really shows that you have an interest and a strong interest in being a self-starter. That is going to be helpful not only to find a job, but just to help to develop your own clinical reasoning skills and to be familiar with common treatments of common diagnoses. Learning some basic skills is going to go a long way. Being familiar with your basic anatomy is a no-brainer, and with treating hands, you are going to have to be incredibly flexible, and knowing your anatomy is going to take you far in being a great clinician. So knowing the basics of anatomy to have a solid foundation is going to be crucial. Also, familiarizing yourself with splinting is going to be helpful. No one expects you to walk into a brand new job and be a splinting pro. Even for myself, I think I didn't become good at making splints until I was at a job after I obtained my CHT, and when I had to make like 4 or 5 splints a day. Was that every day? No. But when you have those basic skills, that's going to be super helpful. So for myself, when I first had my job out of school, I was going to classes all the time. I think my first year out of school, I went to about 2 or 3 continuing education classes, and I went through the ASHT.org website, and I saw different places where they would be offering splinting courses, and that's where I ended up learning and practicing. And honestly, if there are scraps in the clinic, whenever there's downtime, if there ever is downtime, even if you make thumb spicas or wrist cock-up splints for your colleagues or even the front desk staff, that's just going to give you just practice, because even when I went to those classes, you practice on 1 or 2 people and it gives you a feel of the material. But I really don't think you really develop those skills until you're practicing them and doing them more often. So I'm not saying take sheets of expensive splinting material, but there's oftentimes scraps that aren't being used. So if you can use them and just make those common splints that you're going to make all the time, that's only going to help you, and you get an idea of the drape of material. You get an idea of how you like to position your patients. So a lot of it is trial and error. And especially when you see those really complex post-operative cases, if you know how to make these splints on well individuals, there's still a learning curve, but once you have those foundations, then it becomes easier and it becomes much less daunting. And as it relates to splinting, if you can prepare your material as much as possible, if you can look ahead at your schedule and practice, or even have even just a plan on how you're going to attack a splint, that's going to be huge in terms of developing your confidence and making it so that your patients are comfortable with you. So some basic skills you're going to want to know are absolutely knowing your anatomy is crucial in hand therapy. You may think you can skate by, but in order to really be a great hand therapist, you have to thoroughly know your anatomy. I feel like my first couple of years actually, I was doing quite a bit of studying outside of work. So when you're in your interviews, if you can communicate that, like that you're willing to do the work outside of work, that's going to go. So this is where my microphone ended up dying and I wasn't aware of it. But overall, getting into hand therapy as a clinician or even a new grad is definitely possible. And hopefully this video will help you in guiding you in transitioning into hand therapy practice if that's what you're looking to do. And I also want to point out that in addition to mentorship, there are also fellowships that provide training to get into hand therapy. And even though that's not something that I have done, I have worked with clinicians that have found this to be beneficial as well to really help with transitioning into hand therapy practice. If you have any additional questions for me, make sure to leave them in the comments and make sure to hit that like and subscribe button, and I'll catch you in the next video.